What if everything we've been told about cholesterol is only half the truth? For decades, LDL, the so-called bad cholesterol, has been blamed for heart disease. But new research tells a different story. Today, we're diving into a study that may completely shift how you think about cholesterol and your heart health. Hi everyone, it's Dr. Tidman with another research review. Today I'll be reviewing a study that investigated cohort studies in a systematic review to determine, is there any association between high LDL-C numbers and all-cause mortality in people over the age of 60? Remember to subscribe to my channel, and thanks for stopping by. So today we're going to be reviewing a study by Ravenscoff et al. In 2016. They conducted the first systematic review of cohort studies on the effects of LDL-C, that is a calculated value of your total LDL, in older adults over 60 years old, and if there was any relationship between these high LDL-C numbers and all-cause mortality. The studies they investigated reviewed a total of 68,000 participants over the age of 60. Quite a large group. And the studies they reviewed included all of these participants. So cholesterol is essential for life. That's why we care about it. That's why your doctor cares about it. But Ravenscoff decided they wanted to investigate, is there truly an association between high LDL-C and mortality? So cholesterol makes up all of our cell membranes. It helps produce hormones. It even supports brain health. It helps to make up the myelin that covers our axons on the neurons to help conduct electrical activity more effectively. Cholesterol also helps with tissue repair and wound healing. LDL is the cholesterol molecule that carries cholesterol around the body. HDL, you've heard of this cholesterol number, helps carry cholesterol away to the liver, but it also has a lot to do with dealing with inflammation in your blood vessels. It's very protective. So in Ravenscoff's systematic review, they reviewed briefly the traditional cholesterol hypothesis. Notice it's still called a hypothesis because it really has never been proven in a clinical trial. The cholesterol hypothesis is if you have a high LDL-C, this constitutes the bad cholesterol, which leads to cardiovascular disease. This is the traditional view of cholesterol. So the systematic review looked at elderly populations, and surprisingly, in the 19 studies they reviewed with a total of 68,000 participants, they didn't find any clear association between high LDL-C and all-cause mortality. As a matter of fact, they found an inverse association. What does that mean? That means as studies indicated that LDL-C numbers went up in their study population, their all-cause mortality numbers actually came down. In all of the studies they reviewed, 16 of them had 92% of the total participants, and they found no clinical association between high LDL-C and mortality. In fact, in 2 of the cohort studies they reviewed, mortality was highest in those participants with the lowest LDL-C numbers. I bet you've never heard this before. So really, what does this mean for us? Cholesterol numbers alone may not be able to predict heart disease. There are other factors more important, which include things like inflammation, insulin resistance, and oxidative stress. You all have heard me talk about these on my channel many times. Again, LDL-C, high LDL-C, was inversely related to all-cause mortality. Their review gives us a lot of reasons to question the current guidelines used to treat those with high LDL-C, especially older adults. In some of the studies they reviewed, they actually found that higher LDL-C numbers are linked with a longer lifespan. So it's not just about cholesterol. It's about metabolic health. And if you've watched others of my videos, you've heard me talk about metabolic health a lot. As a metabolic health practitioner, this is what I primarily focus on with my patients. So the metabolic health perspective of the root causes of cardiovascular disease, once again, are chronic inflammation in your body, poor metabolic health, and I have some videos posted on metabolic syndrome and type 2 diabetes, which are examples of poor metabolic health, high intake of sugar and processed carbohydrates. And I'll add to this grains. Grains are highly processed and they are loaded with carbohydrates. In addition, a sedentary lifestyle. I have several videos posted on exercise recommendations and activity recommendations for you to improve your metabolic health. And what is the nutritional approach? Consume whole foods more than you consume processed foods. You've heard me talk about shopping the perimeter of the grocery store. The meat, the produce aisle, the meat aisle, the poultry aisle, the eggs, the dairy, and then out the door you go. There's no need really to go in those middle aisles unless you want to grab your coconut oil and your olive oil. Low carbohydrate, ketogenic nutrition. In many of my videos, I talk about the carbohydrate continuum. Some people can be extremely healthy on a Mediterranean-based diet with a higher carbohydrate content. But once you're working on metabolic health conditions or chronic disease, you need to move towards the other end of that continuum, towards the ketogenic end, where you're reducing your carbohydrates to under 20 grams per day. Reduce your sugar, refined carbs, sugary juices, sodas, grains. You don't need any of these. Your body doesn't tolerate them for the most part. And remember to include healthy fats, avocado oil, olive oil, beef tallow, lard, coconut oil, and omega-3s like fish and seafood. Lifestyle approaches also include daily movement and activity, walking, strength training, yoga and stretching, resistance and aerobic exercise. sleep hygiene to improve your quality sleep, stress management, which includes relaxation and breathing techniques, meditation, and prayer. These are excellent for helping to control your reactions to stress in your life. So maybe we should rethink cholesterol. Total cholesterol is only part of the picture, not the whole story. LDL cholesterol alone does not predict heart risk or cardiovascular risk. Focus on inflammation and your metabolic health. Bring in some lifestyle changes rather than chasing lab and treating lab numbers. So, has your doctor ever asked you about your lifestyle or your nutrition or your stress or your sleep? Or have they only looked at your LDL-C number and then prescribed a medication? I'm not faulting your doctor. I'm merely suggesting that there's a whole other part to this story that they may not be addressing. So what is your call to action? I always give you homework. Remember to like, share, and subscribe to my channel. You're going to learn a lot about natural approaches to your health, things you can do at home to take control of your own health, to be empowered to ask your doctor for what you need. Your health isn't just about living longer. It's about living better. Now that we've uncovered a lack of association between higher LDL-C numbers and cardiovascular risk, check out the rest of my channel for specific details on many lifestyle and nutrition interventions you can do at home. And remember to subscribe. Drop a comment below if this content has been helpful for you. And I'll see you in the next video.